Hey y'all, it's Charlie again. I guess it's time for an update. I had my surgery. Looks good, huh? Looks like they tried to cut off my neck or cut my head off and they got bored with it and decided to stop. I got a couple of drains here, a couple of JP drains hanging on my lapel. Looks like a fashion statement. But I wanted to give you guys an update. A lot of information. I realize that my lisp is really bad right now. So I hope you understand all this. I'm not going to try and type it out, put it with the video, because it's honestly, I'm just lazy and it's okay. You'll get it. So today is Saturday, the 14th. Surgery happened Monday the 9th. But I'm going to start the story on Sunday the 8th. Because I was trying really hard to stay calm and it wasn't working. I mean, on the outside, I was calm with Hindu cows, but on the inside, I was a freaking wreck. I decided I wanted to have my last dinner be sushi. And we went out to eat. Went to bed, 8:30. This next morning, starts early. Monday, got up 0300, shower, save, out the door at 4, at the hospital by 5. 5:30 shows up, I'm in pre-op. They got me dressed in a gown. They got me in these socks and these special leg compression things. I guess it's to keep your blood pumping. I saw the nurse. They gave me a couple IVs. The first one to show up first doctor to show up was the anesthesiologist, a woman named Diane. Very nice lady. And thank God she put up with me and my 10,000 questions. Because I have a curious mind. I want to know how this anesthesia works. Because I made the mistake of looking up anesthesia failure online. And that's bad things. Don't look it up. You don't want to know. But I did because I'm an idiot. And I asked her about it. And she told me about how the metrics of anesthesia and how they track where you are and how deep down you are and where she's comfortable putting you. She said if you got to put a number on it, she likes anesthesia to be at a number 50. She says general anesthesia exists between 60 and 40. She likes 50. 50 is good and comfortable. You can come back from it relatively easily with ill effects. But you're down far enough, you don't remember a damn thing. She said, when you're normal awake, anybody walk on the street, about 90. When they start giving you anesthesia, the relaxation stuff, the stuff to relax, it brings you down to about 70. But once you get you down beyond that, you're out, Jackson. I mean, out. So, my normal doc showed up. He was in good spirits. I asked him, how you doing, man? Did you eat your Wheaties this morning? Get in there, do it, make yourself comfortable with it. He said, he's on it, feels good. He's expecting it to take 4 or 6 hours, something like that. He said, I'm going to put you in ICU when we get out, just because it's better to recover in ICU than just to go to a regular room, especially with the amount of crap you got going on. I said, I got it. All right. I'm probably going to be so fucked up, I don't care. So he takes off, goes to scrub them, and the anesthesiologist says, I'm going to give you the first shot, the relaxation shot. She dumps it in my IV. I remember about 2 sentences more. And as far as I'm concerned, I'm blacked out. My wife said that I kept talking and blathering on like a freaking idiot, like I always do. But said that that's about it for me. And let me tell you, I was gone. I mean, I don't remember a damn thing until I was in ICU at the end of Monday. The surgery went well. As you can see, they blew open my neck here, from my earlobe down here at the bottom of my throat. They installed some drain tubes here. You can see the end of that one. The other one's up here in my ear. And they're draining out into these JP drains. Gotta keep them things clean. But they didn't take as much of my tongue as I originally thought. I was told at the beginning it'd be about a quarter. I was expecting to lose about a third. I bet they said closer to 20%. He said that he didn't even need to take the skin graft to fix the tongue. That he'd taken just the right amount to where it could repair the tongue with the meat that's already there. It just closes up like a common wound. Cool. Said because he didn't have to go so much in there, they didn't have to give me the trach. I'm like, cool. Still fucking hurts though. So, I guess I didn't really grasp about how much they were gonna do. I mean, he told me about it, and you know, the logical side of me says I know basically what's gonna happen, but when they mess up your tongue, when they cut your tongue, it affects your ability to use it. And you don't really realize how central your tongue is to everything that involves your mouth. At least I didn't. When he took my wisdom teeth, that's fine. I really don't feel them at all. Well, obviously it's there, you don't feel anything there. But all it did was it affected my ability to close my jaw. It's like the muscles in here have been really taxed, and it's like getting punched in the face good and hard, and that numb sensation afterwards, that's what's going on. And then when they cut me here to get my lymph nodes out, it affects my ability to stretch the skin and move my head. So I can't really move my head very well right now. I can't open my jaw really well right now. I can't control my tongue very well right now. That's why I sound like an idiot. Well, amongst other reasons. But I went through the surgery, got it done, came out, and they put me right in the ICU. And then apparently they were saying they were really concerned about my ability to breathe and my blood pressure. So my pain was really high up there, and they were giving me 2 hits of morphine at a time. I mean, however much it is, I don't know, but apparently they were doubling up dosage and trying to get me to, bring my blood pressure down. And they didn't want to give me blood pressure medication per se because it apparently can affect your ability to breathe. And I'm already having a hard time breathing. One of the first things I noticed when I was starting to come out of it was the fact that they had a feeding tube in my left nostril, which I was expecting. They also had a gigantic freaking plug in my right nostril, which I was not expecting. Well, my right nostril has never worked really well. It's always been kind of blocked, but that's just how it's always been. With both of them blocked, I had to breathe entirely through my mouth. And with the oxygen they were giving me, it was drying out my air so bad, I had the world's worst cotton mouth. Can't breathe, can't talk, can't communicate very well, except for my little whiteboard. And a lot of pain. I mean, it wasn't searing pain, it was like a long, dull ache that you just couldn't conquer. So, anyway, they finally got my blood pressure back down. I got maybe a half an hour of sleep. I mean, the drugs keep you pretty woozy, but real sleep, like conscious sleep, I didn't sleep for days. The first night ICU, nothing. Just always awake, always trying to breathe, always trying to stay conscious and find out what's going on. So all these doctors are coming in and talking about my ability to breathe and my blood pressure and all that shit. So next morning, one doc shows up. he says he's another one of my doctors, and he says they're gonna get me off the morphine. He says we're gonna put you on a fentanyl patch. I've heard of fentanyl before. I've heard it's really stout narcotics. And I said, fine, whatever, dude, do what you gotta do. So they slapped this patch on me. I don't know if you've ever tried fentanyl. And I know cats are out there doing it recreationally, but that's bad stuff, man. It was affecting my perception of reality. I couldn't really tell if I was awake or asleep. I was having hallucinations. I thought I was having a coherent conversation with somebody, and they weren't even really there. Having visuals like you're on acid or something. I remember seeing that same kind of stuff when I'd taken mushrooms before in my life. Like, this is bad stuff. But it wasn't helping me breathe, and it wasn't helping my blood pressure, and I mean, it was helping pain, but it wasn't worth it. Like, I'd rather be higher on the pain scale and be coherent than to be just freaking loopy and still experiencing pain. I ended up asking the doctor to pull me back off of it the next day. But I remember when I woke up there the first day, Mom was there, my wife Brittany was there, and my father showed up. It was really strange to have my mother and father in the same room. But it was good to see them all, you know. Other than that, there's not a whole lot I remember in detail from the first day. I just remember ICU sucks. Second day, no sleep. Doc comes in, says we're going to start you talking to your therapist, someone for breathing, someone for your ability to swallow, for this, for that, blah, 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 blah. Like, okay, come on, bring them on in. I'm not sleeping anyway, fuck it. And the second day was pretty much a haze too. I was really tired and I couldn't focus on much. But I do remember something very distinctly. And that was my colleagues showing up in the hospital. My gym partner, Ken, he showed up. A couple more of my colleagues, Billy and John, they showed up. Well, came as a group. It was really good to see them. I'm glad they showed up. It meant a lot to me to see some familiar faces. And I realize most of you don't know who Ken Wilson is, but he's got a very bright personality, and it was very comforting to see him and experience the the aura that is Ken. Anyway, he's good for the soul. But I really appreciate all three of them showing up. It was good to see familiar faces besides my mom and my wife. Well, I was supposed to be at ICU by day 2, and I wasn't. I was still having issues with my breathing, still having issues with my blood pressure. But by the 2300, they finally got me a room up in the regular hospital. I guess you'd call it a normal room. They got me moved up there in the middle of the night. And I was hoping I could, maybe breathe a little easier, get some sleep. No sleep. The beds suck. I mean, you're obviously in a lot of pain. You don't sleep. There's nurses coming in all the time, taking your blood pressure, giving you shots, taking blood draws. I've been poked more times than I ever care to remember. If you remember, I don't like shots. And I bet you I got 4 or 5 dozen shots out of this crap. So day 3 shows up. I see more of the therapists come around. I'm a little more lucid. And this was the day I tell them, get me off this damn fentanyl. Because I can't sleep. I can't tell if I'm awake or asleep. I'm not getting any rest. I'm not feeling like I'm getting any better. I've got to get a handle on whether or not I'm in reality before I can get any better. So I told the doc, I said, rip this damn thing off of me, doc. I'm tripping balls here. And they put me back on morphine, only for a little while. By that time, I was starting to come back, so they got me on other drugs. I don't remember the name of them, but it wasn't as bad as morphine. But it tapered me off real narcotics pretty quickly. Then I got to see a bunch of the other docs and doing a swallow test and see how well I could work my tongue. That ended up being a whole other deal. I'm not telling you more about that in a minute, but it was good. Once I got off that fentanyl, about a half an hour after I got that patch off of me, I could feel myself getting a grip on reality again, and that was a big thing. At this time, I still had that feeding tube in my nose, and the block, and the other one. I'll post a picture of that thing. I got a good picture of both of them. But I couldn't breathe with them in. I had to breathe through my mouth. And it was bad. And part of the reason I couldn't sleep is because I couldn't breathe. And when I tried to lay my head back and this tube would move, it hurt all the way down. And it would wake me up. So if I did get to sleep, it's like 15 minutes. And I had no way to live. Anyway, so Thursday comes around. Oh, excuse me. I finally get to eat something. And I tell the doc, I know he's coming in the morning. Doc, I haven't slept since Sunday. Like, real sleep. I can't sleep because of this goddamn tube. Get this freaking thing out of me. And he told me, he said, that tube is there in case you can't swallow well. And we have to force food into you. You need food in order to get better. You need the energy. And I told him I can't sleep with the tube in there. And sleep is more important than food. I'm fat. I've got plenty of resources available. I could probably go 2 or 3 weeks without eating and survive it. So get the damn tube out of me. I'll make a deal. You pull this damn thing out of me, I'll eat if it freaking kills me. Okay? I promise you, I will eat as much as you want me to. And he said, are you sure? Because if I pull this thing out and you're going to get food, we got to put it back in. And putting it back in sucks about 10 times worse than taking it out. And let me tell you, taking it out sucks bad. Like, you know what, dude, I'm in. Just pull the damn thing out now. He says, okay. Grab the thing right here and pulled out this tube. It's about 4 feet long down into my gut. Oh, Bubba, I'm going to tell you, that freaking hurt. But it was also a sense of relief. It's like that feeling right before you're going to puke because you're so drunk. And it's like that pain inside you got to get out. As soon as it's out, it's all better. That's how this was. Pull that thing out, I could breathe. Oh, freaking hell. Oh, and that tube was disgusting as hell. And I was like, all right, dude, do the other one. Do it now while I'm riding the adrenaline. Pull it. He said, okay. I'll pull this thing out, and it's a tube about the size of my pinky. And it's long enough to go back down into my throat. When I saw that thing, I was absolutely in shock. Because I've never been able to breathe out of this nostril well. It's always felt blocked. And the size of that thing, I mean, to get it back there, they probably did drill a hole in my damn head to get it in there. I pulled it out, and all of a sudden, I could breathe out the side of my nose. Like, wow, I've never been able to do that before. That's amazing. We pulled it out, and then I had the sensation I had to sneeze. And I held it, and I said, Doc, I gotta sneeze. And he says, go for it. And I sneezed, and I blew chunks of dried blood freaking everywhere. All over the room, all over me, all over him. And I ran over to the sink in the room, and it was just gushing out of my head. So he grabs a bunch of gauze and, almost palms me in the face with it. Grabs the top of my nose and says, pinch it here. We should let it ride. I held on to that thing right there and just drip, drip, drip. It's more like gush, gush, gush. And finally it stops. I'm blowing my nose 2 or 3 more times. But for the first time in my whole life, as long as I can remember, I can breathe real good through my nose alone, and it's a great feeling. But I look at that tube and I think, oh Jesus, man, they had to auger out my skull to get that thing in there. That's really when it turned around for me. When I got those tubes out, I could breathe. The bad news is I didn't sleep that night either. Yeah. But I once got to be able to breathe, I could start swallowing again. I could close my mouth and let the spit in my mouth lubricate my tongue like it's supposed to. And my tongue started feeling better. I could start using it and swallowing again. So next time the doc came around to ask about my swallowing, I passed the swallow test. Good. So it changed my diet again. Oof. Let me tell you, that was good. So I figured, all right, tonight I'm gonna sleep. I'm gonna sleep like the dead. I'm so tired I can't see straight. Like, those guys that do like the crucible and stuff to get into the core and they gotta stay awake for 5 days straight. Those guys are fucking animals, man. Cause I'm doing this with medical help and it's killing me. But anyway, so that night I can't get comfortable, and every time I turn, my neck hurts or something hurts. And then the goddamn fire alarm goes off. And I'm thinking, oh, Jesus, man. I got a 90-year-old guy sitting next to me in this room, and he's knocking on death's doorstep. Are you telling me I'm going to have to throw this old bastard over my shoulder and hump him out of the building on a freaking fire alarm? Ended up building this out of the room. It ended up just being a drill. Yeah. Anyway. And then every 30 minutes they come in there and they want to check my blood pressure and see how much blood I lost and check my breathing. I'm like, just fucking leave me alone. Let me sleep for God's sakes. Well, that was that. I bet you I got realistically about 3.5 hours sleep that night. After all this went down, the nurse that was attending to me, I told her, I'm going to try and sleep, and I need you to just leave me be. If you need blood, come get it out of my IV. If you need something, take it from me. Just don't wake me up. And she says, I'm going to put off all your stuff till as late as I can. We'll just wake you up and do it now. And thank God she did. Her name was Jackie, and I owe her my life. Jackie, you're the best. Anyway, so the next morning, Friday morning, I get up. I'm feeling a hell of a lot better. I passed all of my tests, the swallow test, the PT exam. I got up with the girl that was trying to do my physical therapy, and I told her I'd take her out in the hallway and dance with her. She just leave me alone. And she says, "You really want to get out of here, do you?" I said, "Yeah, I'm ready to go home. I'm ready to sleep. This place sucks." She says, "Yeah, I get that a lot." So anyway, that's about it. Friday they released me. I got home about 5:30. I slept like the dead. They got me all dressed up, cleaned up. I got all my pain meds. I got 1,000 pills that I take forever. I got a doctor's appointment on Monday to do all my post-op shit. But that's about it. It's been a hell of an adventure. There were a couple of details in there that I left out. I don't know, this video is getting kind of long as it is. It's going to take forever to upload. But anyway, I survived it. I'm here. I'm alive. The dope that got me on is still it's still pretty powerful stuff, and it's hard to concentrate. It's going to be a while before I can talk right again, but they left a lot on my tongue. A lot more than I thought. I was able to successfully sing to my daughter today, which is important to me. I want to be able to sing to her and her unborn sister. I want them to know what daddy's singing voice sounds like. So I'm going to come out of it. It's going to be all right. I guess I'm going to find out Monday the final pathology report and find out if I need chemo or radiation. But I got a good feeling about this. I think we're going to be all right. Even if I gotta go through even more of that shit, if it's worse than this, I don't care. We'll make it. It's gonna be good. So, that's it. Again, I'm Charlie. I'm signing off. I'll make another video when I got more to report. But y'all have a good day.